Hello everybody, we're going to go over Chapter 1, Nursing and the Healthcare System. So our objectives here today are for our theory portion, we're going to describe Florence Nightingale's influence on nurses' training, explain why nursing is both an art and a science, define evidence-based practice and explain why it's important in nursing, and trace the growth of nursing in the United States from the Civil War to the present. For our clinical practice, we're going to write our own definition of nursing, discuss how the standards of practice for the LPN or LVN are applied in the clinical setting. So let's start off with historical overview. Nursing in England and in Europe. So illness was often believed to be caused by sin or the gods' displeasure. After the break between King Henry VIII of England and the Catholic Church in the 1500s, care of the sick was left to the government. During the Crimean War, Florence Nightingale asked the Secretary of War to allow her to train women to care for the sick and wounded. Florence Nightingale's group lowered the death rate from 60% to 1%. That statistic is staggering and very impressive. The Nightingale nurses made their rounds after dark with the aid of the lighted oil lamp. The lamp has become the official symbol of nursing. Which of Florence Nightingale's curriculum principles still apply today in the treatment of illness? So her curriculum principles are nutrition is important, part of nursing care. Fresh, clean air is beneficial to the sick. Nurses should identify and meet patients' needs. Nursing should be directed toward health and illness. Nursing distinct and separate from medicine and should be taught by nurses. And nurses need continuing education. So which of these principles still apply today? Does anybody know? How about all of them? They all apply still today. Modern nursing has gone to great lengths to distinguish itself from medicine. Each is distinctly different profession, yet they are codependent for optimal patient outcomes. Nightingale's influence still exists in the 21st century nursing practice. Her nursing school curriculum addressed many of the same things included in modern nursing education. Nursing in North America. So the Union government appointed Dorothea Dix to organize women volunteers to provide nursing care for our soldiers. Clara Burton took volunteers into the field hospitals to care for soldiers of both armies. Clara Burton also is the founder of the American Red Cross. Lillian Wald took nursing out into the community. Does anybody know who the person was to establish Henry Street Settlement Service in New York City? That would be Mary Brewster. Some trivia for you. Here is a Red Cross public health nurse posing in front of a Model T before setting out on rounds. Nursing in North America, we have the Ballard School. The Ballard School started by New York's Young Women's Christians Association, or YWCA, in 1892. It had a 3-month course in practical nursing. That's not too long. We could do 3 months, couldn't we? Students are trained to care for infants, children, and older adults in the home. Then we have the Household Nursing School in Boston that's later called the Shepherd Gill School of Practical Nursing. It was established to train nurses to care for the sick at home. A legacy left by Thomas Thompson allowed Richard Bradley, the executor of the will, excuse me, to open a practical nursing school in Brattleboro, Vermont in 1907. Here's a picture from your textbook. This is some of the first African American nurses to serve with the U.S. Army. They really paved the way. Training in the Nightingale schools was well organized, with classes held separately from practical experience. In the United States, however, training occurred bedside with no formal classes or curriculum. Can you guys think of like some advantages or disadvantages of teaching nursing classes from a standardized curriculum? I think that there's pros and cons to both approaches. However, I do think classroom is definitely necessary, because if we're just operating, let's say you guys were just going to nursing school and just going to clinicals, you're only going to be going over the patients that you're actually taking care of. And so a lot of conditions and diseases, disorders might be missed. You're not going to cover everything if we're just using clinical experiences. In World War I, nurses tended to the wounded and the sick behind the front lines. The first African American nurses serving in the U.S. Army paved the way for others to follow. And in World War II, the demand for nurses to serve in military hospitals increased significantly. Nurses continued to serve in times of military crisis, including Operation Iraqi Freedom. Here is a picture of a group of nursing students during the 1930s or 1940s. Here is a picture of nurses caring for patients on a hospital ship. And lastly, a nurse that's dispensing medication for a civilian patient in Iraq. So we have 4 common goals of nursing: to promote wellness, to prevent illness, to facilitate coping, and to restore health. To accomplish these goals, the practical nurse takes on the role of a caregiver, an educator, a collaborator, and a manager. The nurse's goal is to encourage growth towards wellness so that the patient can once again be self-reliant. Now, what are interventions? Can you guys think of a few examples of an intervention? What's the actual definition of intervention? Interventions are actions taken to improve, maintain, or restore health or prevent illness. One example of an intervention is to put a person on oxygen, to actually put the nasal cannula on the patient, to administer oxygen. Another intervention would be to administer medication, or to assist the patient with coughing and deep breathing, or incentive spirometry. Those are all interventions. Roles of the practical nurse. So roles of the practical nurse include implementing interventions, which we just kind of talked about, to improve, maintain, or restore health. In our educator role, we are going to provide health teaching and counseling to promote wellness and prevent illness. I do see the spelling error in health there. Have to make sure I fix that. Collaborator, we want to work with the RN and the healthcare team to provide continuity of care. So I want you to pay attention to these 2 words and know collaborator and continuity of care. Make those connections right now. Those, I want you to just draw a line from collaborator to continuity of care. We're going to work with a team of healthcare providers in order to get our patient feeling better and going home. That could be case management, that could be the doctor, that could be physical therapy. Actually, it's everybody all together. So collaborating for continuity of care. Then we're going to advocate for our patients. We are going to be a champion for the patient's best interests. We're going to fight for our patient's best interests. We're also going to be a manager in some sense. We're going to assign minor tasks to the nurse assistant or other ancillary personnel. You, as a nurse, as an LPN, you are going to delegate responsibilities to your coworkers, your nursing assistants, or other ancillary personnel. Evidence-based nursing. So the promotion of evidence-based nursing has become stronger around the world over the past decade. Students are being taught the skills to discriminate between high quality and flawed research and to interpret the study results. What do we use to establish best practices? Well, we're going to use evidence-based nursing. Evidence-based nursing is research that is done to provide guidance for nursing administrators to come up with policies and procedures to determine what best practices, quote unquote, actually are. So when you see evidence-based nursing, I always want you to connect evidence-based nursing, that term, with the term research. It's based on research. Evidence-based is research. Question number 1. Florence Nightingale's beliefs are still the foundation of nursing today. She was responsible for 1. Founding the Ballard School of Practical Nursing. 2. The belief that continuing education is necessary for nurses. 3. Apprenticeship training. Or 4. Founding the American Red Cross. The answer is number 2, the belief that continuing education is necessary for nurses. Florence Nightingale believed in the value of education for nurses. She started the first school of nursing in England and encouraged nurses to continue their education even after graduation. We still do that today. You have to do your CEUs after you become a nurse. The training in the Nightingale schools varied considerably from that of the U.S. nursing schools. Which statement is correct concerning the differences? Number 1, the Nightingale program was less organized. Number 2, student nurses in the United States worked for minimum wage. Number 3, curriculum in American nursing schools was more standardized. Or number 4, instruction was done at the bedside by a physician in the United States. It is number 4. Number 4, instruction was done at the bedside by a physician in the United States. The training in the Nightingale schools was well organized, with classes held separately from the practical experience. The United States held no formal classes and no set curriculum. Instruction was accomplished at the bedside by a physician and therefore came from a medical viewpoint only. Okay, nursing education and the nursing environment. So we're going to discuss the ways in which the desirable attributes of a nurse might be demonstrated. We're going to identify the educational ladder that is available to nurses. We're going to describe educational pathways open to the LPN, LVN after graduation. And we're going to compare methods of delivery of nursing care. We're going to list 4 practice settings in which LPNs or LVNs may find employment. We're going to discuss today's healthcare system, its components, and changes proposed. We're going to also explain how an HMO and a PPO differ. And last but not least, we're going to relate how the recent healthcare legislation has affected your own healthcare. For clinical practice, we want to list the practice areas in the community in which you could be employed as a vocational nurse. So, current nursing practice. The Nurse Practice Acts generally define activities in which nurses may engage, state the legal requirements and titles for nursing licensure. They also establish the education needed for licensure. What are the standards of nursing practice? Does anybody know? These contain 17 standards of national practice of nursing, describing all facets of the nursing practice: who, what, when, where, and how. These standards for the professional RN protect the nurse, the patient, and the healthcare agency where nursing care is given. Please make sure to look in your book for the table that goes over that information. Now, when we talk about the nursing process emerged during the 1970s, 1980s. It is a circular process involving ongoing assessment. It is organized, it's deliberate, it's systematic in the way that we provide nursing care. It provides a way to implement caregiving. It combines science and art of nursing, and it focuses the nurse on the patient as an individual. Here is a figure of the nursing process in that circular motion. I want you to write down the acronym ADPIE right now. I want you to remember it, ADPIE, ADPIE. A is assess. You're going to gather information and review history. D is diagnose. You're going to identify the problem list. You're going to P for plan. Develop your goals, your desired outcomes, and your action plan. Your I is perform nursing actions. Implement, perform nursing actions. Remember, I said use the terms implement and intervention interchangeably. So performing nursing actions is the definition of interventions, correct? So you can make sure you make a note of that. And last but not least, evaluate. You want to ask yourself, were the desired outcomes and goals that you set achieved? Were they? If not, we need to start over in our nursing process. Practical nursing was created to fill a gap left by nurses who enlisted in the military services during World War II. Practical or vocational nursing programs generally take about 12 to 18 months to complete. What caused the ANA to propose that the bachelorette degree be necessary for entry into professional nursing practice? It was the push towards professionalism, unification, and higher educational standards or consistencies for nursing. That's where the push came from. LPNs can utilize 3 different types of programs. They have hospital-based diploma programs, 2-year associate degree at a community college, and a 4-year at a bachelorette nursing degree program or at a college or university. Graduate programs for master's and doctorate degrees. So nurses that are prepared as specialists in various clinical branches of nursing in research or administration. Those are 2 examples. Nurse practitioners may specialize in family practice, pediatrics, maternity, psychiatry, adult health nursing, or geriatrics. And once licensed, can practice more independently as a as opposed to a registered nurse. They can't practice independently. The ANA set up a separate American Nurses Credentialing Center to enhance the professional image of nursing. From whom can an LVN or an LPN receive a specialty certification? After completion of an LPN/LVN curriculum and or licensure, the graduate can seek certification by NAPSNES or NAPNES in pharmacology, long-term care, and or IV therapy. So there are some certifications you can obtain when you're a LPN. Under functional nursing care, care of the patient was rather fragmented. It is the first care delivery system for a practical nurse. Practical nurses perform tasks such as administration of medication and treatments. Team nursing evolved in the 1950s and extended into the mid-1970s. Team nursing worked fairly well as long as there was excellent communication among the members and the team leader evaluated care delivered. The registered nurse was the team leader who coordinated care for a group of patients. Work tasks assigned to the other team members, practical nurses, and nurses' aides. Total patient care highlighted the benefits and the inefficiencies in this particular system of nursing care delivery. One nurse carried out all nursing functions for the patient, including medication administration, to provide less fragmented care for the patient. That's total patient care. Now, primary nursing appeared in the 1960s and the 1970s. Because research is showing better patient outcomes with more of the care being delivered by nurses, there is a trend back to total patient care. One nurse plans and directs the care for the patient over a 24-hour period. It eliminated fragmentation of care between shifts, often modified with the use of cross-trained personnel assigned with help duties. The difference in practice setting provides patient contact with healthcare according to the patient's stage of wellness. Often patients do not realize the level of care is needed and will use emergency rooms as non-urgent care sources. Specialized facilities allow patient care at reduced rates, but not having all patient treatment services. Having care provided in the patient's home or nearby emergency center often offers patients with limited transportation options care that may not be available otherwise. Palliative care and long-term in-home care or support by home health agencies. Different levels of care also allow opportunities for the patient to receive care without the expense. We have preventative, primary, secondary, tertiary, restorative, and continuing care. There's a nice table in your book in going over the levels of health care. Please look at that in Chapter 1. Today's healthcare system, we have HMOs. HMOs enroll patients for a set fee per month. They provide a limited network of physicians, hospitals, and other providers that you choose from. And one goal is to keep patients healthy and out of the hospital. Our PPOs offer discounts on fees in return for large pool of potential patients. They allow the insurance companies to keep premium rates lower and make insurance coverage of employees less expensive for employers. So large businesses and insured groups may contract with PPOs instead of HMOs. There's also usually a larger number of physicians to choose from in a PPO compared to an HMO. The managed care environment. Now there's quite a controversy over this. Nurses must constantly think about cost containment while trying to give optimal care to patients. So what they're talking about is documentation is very important because every treatment and each use of equipment must be documented with evidence showing it's needed. Why do we have to do such vigilant documentation? Well, because they want to, the goal is to be able to catch the beginnings of complications before they become serious and prevent them. It also is cost containment. Let's be honest, it's also cost containment, and that's where the controversy comes in. Some people are saying that the insurance companies are making facilities do all this documentation because they don't want to pay for these things, and the insurance companies are just trying to find a way, well, this is what they say, they're just trying to find a way to catch complications before they become serious. I don't know. So the Patient Protection and Affordable Care Act is a requirement for it is required now for uninsured people to purchase health insurance or face a penalty on their income taxes. Provisions in the bill prevent denial of coverage based on pre-existing conditions, and young adults are allowed to remain on their parents' insurance through the age of 26. The national uninsured rate has fallen from 16 to 11%. This is important to think about and talk about and be aware of, because our current presidential election, we have one side that wants to keep the Patient Protection and Affordable Care Act, and we have the other side that wants to get rid of it. So based on your political stance and what's important to you, would probably decide what you're in favor of and what you're against. Question number 3, assisting a patient with daily hygiene needs is an example of an 1, intervention, 2, invasive procedure, 3, standard of practice, or 4, nursing goal. The answer is number 1, intervention. Caregiving skills are interventions aimed at restoring and maintaining a person's health. Interventions are actions, once again, taken to improve, maintain, or restore health or prevent illness. Question number 4. As the role of the practical nurse expands, employment opportunities have increased as well. All of the following are appropriate practice settings for the LPN except number 1, a physician's office. Number 2, home health agencies. Number 3, public health. Or number 4, ambulatory clinics. The answer for this is number 3, public health. Practical nurses work in the areas where there is supervision by a registered nurse, physician, or dentist. Community nursing, school nursing, and public health nursing presently are primarily the arenas of the professional registered nurse.